Hello, my name is Dr. Joel Gan and I'm the resident consultant physician from Kensington Green Hospital. I'm a specialist in internal medicine and I deal with prevention and treatment of various medical conditions. There are receptors located at the back of our throat, our airways and also our lungs. When our body detects something that is harmful to our body that will affect these areas, our body will cough to expel out the harmful substances so that we can remain healthy. There are two types of cough. One is the wet type of cough whereby we might produce some sort of sputum, and then there's a dry type of cough where there's no sputum, and this might indicate different type of diseases in the body. Typically, people would say that a yellowish sputum would indicate bacterial infection and whitish sputum will indicate a viral infection. However, this is not necessarily true all the time because both bacterial and viral infection can cause yellowish sputum. In fact, both bacterial and viral infections can have similar symptoms such as fever, chills, runny nose, and a cough which produces sputum. To know whether your infection is bacterial or viral in origin, you will need to see a doctor who will then investigate by looking at your sputum and taking blood tests to look at your white blood cells to see whether it is bacterial or viral in origin. A cough can be classified based on its duration. So for example, a cough that just started up to 3 weeks is classified as acute cough, whereas a cough that lasts up to 8 weeks after that is called subacute. If your cough does not resolve in 8 weeks' time, then we will classify the cough as chronic cough, after which we would need to identify why cough is not improving. Most of the time, if you're having a simple viral infection or even a bacterial infection, after treatment, your cough should resolve within 3 weeks. Sometimes after an infection, the cough might last up to 8 weeks because of hypersensitivity in the airways. The common conditions associated with a chronic cough are postnasal drip, secondly asthma, which often goes undiagnosed, and thirdly gastroesophageal reflux disease. Postnasal drip is a condition whereby the mucus or the secretions from the nasal airway goes backwards into the throat, and this causes irritation to the throat and this induces a cough. Asthma is a condition whereby the person's airway or the lungs are sensitive, and when exposed to certain conditions such as dust or pollen, this causes the airway to become tighter and constricted. The person might have difficulty in breathing or noisy breathing. Thirdly, gastroesophageal reflux disease is whereby the acid in the stomach goes backwards and irritates the throat, and this can also cause a cough. It is also associated with a sour taste in the mouth. If the three common causes of cough has been identified, treated or ruled out, but the cough persists, then we will have to look at other causes of cough and try to investigate further. Other causes of cough include tuberculosis, lung cancer, or even certain medications that lower the blood pressure may induce a cough. So, the doctor must take a thorough history and do a proper physical examination before proceeding to further investigations such as X-ray, spirometry or CT scans to diagnose the patient and find out what is the cause of the cough. If you're experiencing a cough at home, there are several things that you can do at home to help with the cough. Firstly, putting a humidifier in the room will avoid the environment from getting too dry and irritating the back of the throat. Secondly, avoid cold icy drinks and have warm drinks, as this will help numb the back of the throat and reduce the sensation to want to cough. Thirdly, what you can do is to go to the pharmacy to get over-the-counter medication such as lozenges or cough syrups, and this will help suppress the urge to cough. Fourthly, if you are a smoker, avoiding smoking or stopping smoking will help in terms of reducing the urge to cough as well. If you are known to have allergy conditions such as allergic rhinitis or asthma, avoiding the triggers such as pollen, dust, or even pets at home will be helpful in reducing the severity and duration of the cough. After trying self-help home remedies, but the cough does not resolve after 10 days, it is time to see a doctor so that he can properly examine you and advise you on the best investigations and treatment plan. If your cough is associated with certain red flag symptoms, then you would need to see a doctor as well. So red flag symptoms include unintentional loss of weight or coughing out blood, severe breathlessness, chest pain when you breathe in, or fever that won't go away. So these are the conditions associated with the cough that should prompt you to see your doctor.